Okay, then, for the next presentation entitled Precision Medicine Strategy for bAVM Management, an Integrated Metabolomic-Radiomic Model with scRNA-seq Analysis, presented by Zhou Yangyang from Naval Medical University.
Esteemed professors and reviewers, it's regrettable that unforeseen circumstances have unnecessarily shifted from an in-person to an online presentation. However, the opportunity for transnational academic exchange remains truly accelerating. It's my privilege to present our research on precision medicine strategy for brain arterial venous malformation management. Brain arterial venous malformation, or bAVM, is the leading cause of intracerebral hemorrhage and stroke-related disability in young adults. Managing bAVM is profoundly challenging because it often presents with insidious symptoms. However, the outcomes are fatal. I will never forget a case 2 years ago. One of my fellow students, bright and healthy, was rushed to a hospital with a spontaneous intracerebral hemorrhage. It was a dire emergency. Thanks to the swift action and expertise of our instructor, Professor Lee, a life was saved. However, saving one single life is far from enough. This case highlights critical unmet clinical needs across 3 key stages of brain arterial venous malformation management. First, in primary diagnosis, we critically lack non-invasive tools for early screening. Second, in clinical intervention, whether it's surgery, embolization, or radiotherapy, all carry risks. We lack effective drugs for bAVM. Third, in post-therapeutic management, it's challenging to precisely identify the risk of recurrence. To address this, we designed a comprehensive multi-omics strategy. From metabolomics, we built a patient cohort, screen for different metabolites, and build a diagnostic model, aiming to find the molecular fingerprint for early diagnosis. From radiomics, in parallel, we built an imaging cohort, deeply mining radiological features to build a prognostic model. Integrating both radiological and metabolic data, we then created a powerful integrated model. We didn't stop at correlations. We pushed further into mechanism to find the why behind our findings. From bedside to bench, our results are fruitful. Result 1, by preliminary experiment and analysis conducted on blood sample from 10 bAVM patients and 10 healthy controls, a specific metabolomics landscape of bAVM patient serum stood out, demonstrating a strong link between bAVM and dysregulation of lipid and methionine metabolism. We built a non-invasive predictive model for early screening on basis of metabolomics. Result 2, simultaneously for radiomic landscape, based on digital subtraction angiography, we have identified risk stratification of radiomics includes shape, sphericity, and so on. Using machine learning, we built a preliminary prognostic model for recurrent risk evaluation. Its clinical value was confirmed by decision curve analysis, risk threshold effect plot, confusion matrix, and prediction precision distribution. For the second part, we built a preliminary prognostic model for evaluation of recurrence risk. Result 3, the integrated model. We found that metabolomic characteristics strongly correlated with angio architecture. By integrating the 2 datasets, we built a superior prognostic model for evaluation of recurrent risk compared to either model alone, enabling more precise recurrent risk assessment. But what was the molecular mechanism behind this correlation that led to our fourth result, mechanism exploration? In bAVM tissue, we confirmed altered expression of enzymes in the methionine metabolomic pathway. And drilling down, we did identify that methionine AP2 expression is increased and shows aberrant co-localization with vascular endothelial cells. In vivo, the targeted methionine AP2 inhibitor, fimagene, significantly inhibits nidus formation. In various studies, such as Western blot and scRNA-seq, provided further evidence. You can see these images. For mechanism, we have identified methionine AP2 as a co-regulator of methionine metabolism in abnormal vascular architecture formation, fimagene as a potential therapeutic drug for bAVM. From pathway and andro architecture to mechanism, we have successfully built and integrated our integrated model. In summary, correlating metabolomics with radiomics, our study is the first to build a diagnostic and potential integrated model for bAVM with core features such as methionine AP2 and fetal artery count. Our work suggests that methionine may serve as an early detection biomarker of bAVM. Our integrated model can play a pivotal role in treatment evaluation. The methionine AP2 fimagene axis represents a novel and promising therapeutic target for drug development. Starting from the emergency rescue of one patient to the completion of this systematic research strategy, we hope our work can contribute to earlier diagnosis, more accurate evaluation, and better treatment for bAVM patients. Thanks for comments and suggestions.
Thank you for the fascinating topic. Do you have any comments or any questions?
Can I ask for the source of the sample that you use for metabolomic and radiomic, and how many samples that you select in this study?
Well, sorry for the internet, and I'm here again.
Okay, so I want to ask the source of the sample that you use. Do you use from the tissue or you use from the blood serum to study the metabolomic and radiomic?
To be honest, we use digital subtraction angiography for our patient. For example,
okay, and how many cases that you use in your study?
350 is only a one center analysis, so we think that we can extend to external validation using multi-center data to test its robustness.
Could you repeat the answer again?
We used the tissue of 350 patients. It's only a single center data. A major next step is external validation using multi-center data to test its robustness.
And what is the next step for your validation of this model?
Yeah, for example, we can extend to other hospitals, for example, international hospital or other institutions.
Validation data is come from the same center, right?
Yes.
Have you ever
It's also
tried?
our
Okay. Have you ever tried your model from the data, open data or data from other centers, whether it's still give high reliability?
given that there are minimal tests for brain arterial venous malformation. For example, we have few patient tissue, and our hospital is one of the best institution to cure those things and do this digital subtracted angiography is a very big problem to identify the qualification of those brain arterial venous malformation imaging. So we have to do some further research.
Thank you for a fascinating topic.